So some behind the scenes, as I started to film this video, I looked and I was like, oh, my light's not perfect. Oh, let me wait and film it later. And then I realized this is the perfect time to film because today it's World Mental Health Day. And a lot of us, when we show up to work, we're feeling less than perfect. And as a manager, your teams are often showing up feeling less than perfect. So if imperfection today means that I have a bright light shining on me, then so be it. But in this video, I'm going to talk about supporting true mental health at work and 2 things that you can do. 1, as a manager, and then 2, as an organization, and things that employers can do to help support their employees' mental health. So first, as a manager. So in the show notes or video, again, I'm not perfect, but I'm going to keep just filming. I will talk about the study from UKG that I've read and I talk about a lot. UKG is a payroll HRIS system, but they have a research group that this year did research to show that managers can have more of an impact on employees' health, including mental health, than their doctor or their therapist. And I sit with that a lot. That study came out about 9 months ago, and I think about it and talk about it constantly. And so as a manager, it can feel overwhelming. Like you have so many things to do. But often, support of someone's mental health can be the way that you work with your employees. And it can be the things that you can do that don't require any budget. Things like last week I did a video on the one question that you can often ask, which is asking yourself, which is what would I want to have happen to me in this situation? So some of those things that can support mental health are the way that you talk to people. One of the things, as I put out videos on social media, is I get a lot of comments about a variety of things. But some of the comments will talk about people's very deep experiences at work. And frequently it's a comment of, I had PTSD or I had incredibly low self-esteem because of the way my manager talked to me, the way that they didn't believe that I knew what I was doing. And managers on the flip side, like I'll post things that'll say, sometimes people have emergencies. And I'll get comments from managers that'll say, well, what if you can't trust people because they always seem to have an emergency? And so the reason I had the video from last week about asking that question, or that I'll talk today about the way that you talk to employees and how that can impact mental health, is that if you manage by the exception or by assuming the worst in people, then let's assume that you don't care overall about the employee, or you think a lot of what people talk about in psychological safety and the like is a lot of fluff. But even if you are focused on getting work done, employees cannot get their best work done if they feel like their manager doesn't trust them and doesn't believe in them. And that can have really deep impacts on mental health. So thinking about your employees, oftentimes people will say, bring your true self to work. Well, what does our true self mean? That means sometimes you personally, you may feel like you can come and knock things out and you're having a productive day. Other times you may have things going on, life things, or you may have a lot of challenges at work and you're just trying to get through the day. Each of your employees is the same. And so proactively talking to employees and saying, as we come to work, we have things that we want to get done. Sometimes you're going to be able to knock those out. Other times you may be having challenges and your best is like 50%. So I want you to know that I understand it, and there's going to be sometimes that we're going to need to really focus in and get things done. But there's also going to be times that we need to then take a step back and exhale, or you may have things going on. And so I want it to be an environment where only share whatever you're comfortable with. But I want you to know that I recognize that some days our best is a much different version of ourselves than it was yesterday or tomorrow. And so in mental health, the one thing that I want to talk about as a manager is the thing that you can control, which is how you talk and work with employees. So thinking about this, asking questions. You can go back and look at the video from last week to think about how you can ask yourself, how would I want to be treated in this situation? Even if you see employees at their worst, meaning work performance, like they're making mistakes, they're not getting things done. Having that conversation rather than jumping ahead or just leaving feedback for their performance review. Talk to them about it so that people aren't surprised. Those type of conversations and how you directly work with employees can have huge impacts on their mental health and otherwise. So that's what you can do as a manager. And again, I don't want to overload managers by giving you a list of 10 things to focus on. It's just that. Thinking about how you talk to and work with employees. And if that question from last week is helpful, how would I want to be treated in this situation? To have very simple tips that you can actually roll out in your work. So the second is for organizations. And again, I'll give one tip that can be helpful because I probably have a lot of tips. You probably know that I have a lot of thoughts on different subjects if you watch many of my videos. But for organizations, one thing that I encourage every organization to do, especially in the US, where medical benefits are often through work if people are eligible, or employees may not be eligible and have to get it themselves, but one is to have an employee assistance program. And for organizations that already have an employee assistance program, I'll put a timestamp so you can jump ahead of how I talk about using that. And if you don't know what that is, it's fine. Employee Assistance Program, or EAP. What this is something that employers, and I do believe this is normally a unique US program, but I'm curious if others globally have seen this as well. I've worked globally, and I don't actually know the answer to that. But an EAP, certainly in the US, is a program that often has, right now, a lot of employers are going through open enrollment and their benefits. And so in open enrollment, that means that employees may be opting into benefits, choosing, if they're eligible, whether to enroll in your plan, or if they have coverage through a spouse, a partner, or the open marketplace. Whether they're getting insurance or not, often what you can provide to all employees, regardless of whether they're eligible for your medical benefits, whether they participate, is this employee assistance program. And how this tends to work, and you can talk to your benefits broker because they'll be the experts, but this is where the employer pays the entire amount. But it doesn't tend to be a lot of money in the grand scheme of things. It is a financial cost, but what this means is it's a program that employees can opt into, again, whether they have insurance with you or not. And what an EAP can be can vary. It can include mental health and counseling. So your employees, whether they participate in your medical insurance or not, they and their dependents, so again, meaning, again, depending on the plan, like their children, their dependents that live with them, their spouse, their partner, can get access to free mental health resources, including counseling, therapy visits. And this can be often free out of pocket. And while these plans can vary, this can be a huge resource by people that may say, well, I'd like to have this kind of support, or my child needs this support, but it's too expensive. They may not realize they can have a potentially free resource. So if you haven't had a conversation with your benefits broker, I really encourage talking to them about what would it look like for us to have an employee assistance program? What coverage could we have? Other aspects of employee assistance program can be more like financial counseling, other aspects like that, like life type services. And while those plans can vary, and while that is a cost, again, it's often so cheap relative to the overall healthcare premiums that your organization is likely paying. So I incredibly encourage organizations, whether you're going through open enrollment or talking to your benefits broker, to get a sense of that, because it's something that can really, really help employees. So now is the timestamp that I told you to skip to if you already have an EAP. Or if you're like, okay, we're going to use an EAP, but what's next? So an EAP is this program. One of the biggest problems with an EAP is that people may not know about it. Because, especially if you don't participate in insurance, a lot of employees may think, well, I don't have access to anything because I'm not paying into insurance. But if you have an EAP that everyone can participate to, make it an internal marketing program, meaning to communicate to employees. If you have email systems, intranet, talk about it. If you have physical locations with bulletin boards. Last year, I'd done a talk, I'll also include in the notes, with Felicia White, who I've known now for years. We did a program on mental health and substance abuse in the hospitality industry for Chart organization. And we talked about how when you're in person, restaurant, retail, or hospitality, healthcare, having that bulletin board and having managers talk about the EAP. I've seen situations where managers have actually talked about their experience with the EAP. Nobody should ever feel compelled to have to do that. But having a manager even talk and say, hey, we have access to this, plug this into your phone, this is free, they can call, and this number can explain what you and your family are eligible for. It can potentially include counseling visits and those things. They can tell you about that. But sometimes that type of marketing program can be one of the most important things that you do. So on this mental health day, again, I'll have some notes below in the show notes. Why do I keep saying that? It's a video, but I'm going to keep recording. But in mental health, for managers, thinking about how you talk to employees. And sometimes I say, when you talk to people, you can build them up or you can bring them down. And even when someone seems to be at their worst moment, they are still a human being at work. And so talking to them clearly, hearing their perspective, can have much bigger impacts on their mental health than you might think. And for organizations, thinking about those resources in EAP and then promoting it so it's actually used. Because generally what you pay for it, I don't think it depends on how much it's used. So I incredibly encourage it, and I appreciate you all for chiming in. Thanks.